This video will introduce the updated workflow for creating the Patient Discharge Handout and an overview of how information from nursing and allied clinicians will now be incorporated into a single document for your patient. The most significant enhancement to the current workflow is that nursing and allied clinicians will now contribute their own patient instructions to a single comprehensive PowerForm in Cerner. This ensures that a unified and clear set of instructions in plain language is communicated to your patient from all members of the healthcare team in this printed handout. As a provider, you'll continue to be responsible for documenting your patient's discharge instructions. All providers will create their note from Provider View. Select the Transfer Discharge tab and scroll down. Here, you'll select this hyperlink when you're ready to create the Patient Discharge Handout. Please avoid creating the handout too early. It's essential to coordinate with your interdisciplinary team to ensure all necessary contributions by nursing and allied have been made to their PowerForm. Their instructions for the patient are viewable under Documentation when changing the filter to Display All. A new Patient Oriented Discharge Summary or PODS document is created each time a member of your interdisciplinary team documents in a PODS PowerForm. When the Patient Discharge Handout note is created, it will automatically pull in documentation from the PODS PowerForm and other parts of PowerChart. Now let's review a few ways in Cerner that providers can document instructions for the patient. Even before creating the handout for your patient, you can document the instructions in the Patient Instruction Handout Discharge Summary component. This free text box is available in the Rounding tab and Transfer Discharge tab and is meant to act as a personal scratchpad not viewable by others. Your notes here will not only pull into your Patient Discharge Handout but also to your Patient Discharge Summary. Once you enter clear and patient-friendly instructions, click Save. Providers also have the option to include notes in the Procedures and Treatment Provided free text box. It's available in the Transfer Discharge tab. Another way to input instructions is by creating a Discharge Patient Instructions order. Follow your standard procedure to add this order. In the comment box, input relevant instructions and click Order for signature. Let's now focus on the Patient Discharge Handout itself. We'll go over what information auto-populates into your note and from where. Next, we'll review how one can add or modify information directly in the note before signing. Lastly, we'll highlight key features built into this multidiscipline document. My contact information and support person details pulls from PODS PowerForm. Primary care physician information under my hospital stay is recorded during registration. The hospital stay section also pulls in the names of providers who entered the patient's chart and established a relationship. The name of the MRP is also identified. If providers are missing, you have the option of adding other specialists consulted directly into the free text field. The reason I was in the hospital section pulls in information from other parts of PowerChart, but you can directly add in more information about the patient's journey. The notes entered earlier under the Procedures and Treatment Provided component have now pulled under the same heading here. If any details had been entered into the History section of PowerChart that lists surgical records and procedures, they would also populate under this section. Immunizations ordered also auto-populate. As we scroll down, here you'll see that the Discharge Patient Instructions order and the free text notes entered earlier in the Patient Instructions Handout Summary free text box have pulled in. If you choose not to enter the patient's instructions as demonstrated earlier, you can still enter instructions directly into your note. A reminder though, do not create your note too early as you may miss documentation from allied and nursing team members. How I might feel and what to do as well as changes to my routine are both pulled from the Nursing and Allied PODS PowerForm documentation. Next, in the When to Get Help section, standard instructions are listed. If this needs to be revised, you can do this directly in this free text box. Further down, follow-up appointments will automatically list any appointments entered and scheduled in Cerner. Any out-of-system appointments can be entered directly here. Follow-up instructions to my healthcare team is a free text field for your notes. A reminder, a copy of this Patient Discharge Handout automatically distributes to the patient's primary care provider, but not to Care Connect. Sharing of my information is a standard text. Next, my contacts can list the CML or any other member of the interdisciplinary team from the current encounter if it's been entered in the PODS PowerForm. My community contacts pulls information entered in the patient's chart during current and previous encounters. Other information for me populates here when the nurse enters instructions for the patient in the PODS PowerForm. The medication section lists all the medications that were selected to be continued by the provider when completing the discharge medication reconciliation in the current encounter. If by the time the patient discharge handout note is created but a discharge medrec has not been completed, a disclaimer will appear for the patient to discuss medications with their healthcare team, since a medication list will not populate without a completed discharge medrec. Lastly, at the bottom of the handout, there is a note for the patient that states the handout is a consolidation of documentation from multiple contributors. If either a provider or nurse creates the handout, their name does not show on the printed copy given to the patient, but does still appear in Cerner. If another provider or a nurse attempts to create a patient discharge handout when one already exists in the current encounter, an alert will appear to avoid the creation of a duplicate. In some cases, it may be appropriate to create another handout, for example, if there have been some significant changes to the discharge plan or information for the patient. This alert is not visible when printed. Some quick tips. Remember, if you want to add more details to your note, hover to discover the toolbar next to headings and click this icon to create a free text box. Don't be concerned about deleting empty sections of the patient discharge handout before signing. Empty sections do not appear when printed. Thank you for viewing this video. If you need support on Cerner, please do not hesitate to reach out.